Wow, thank you very much for such a stimulating discussion, and your slides are excellent. I have some questions myself, but I first want to open it up to others to ask questions. So feel free to interject.
You can ask any question you like.
Well, hi, this is Rox Anderson. I love your work. I thank you so much for doing such a good job, not only with your patients, but for teaching.
Dr. Anderson, I didn't see your photo, and I think.
Dr. Rock Anderson, I am very happy to meet you here. I hope that all the people in the world know Rock Anderson. He is the inventor of the laser surgery selective photothermolysis. And I am very happy to meet you here, and it is a chance to talk to you. Thank you very much.
And now I see you.
Okay, well, they're going to know you soon, because I was just saying thank you so much for doing a great job, and not only for your patients, but also for teaching us. I'm filled with questions for you. One of my questions is, when you're doing the treatment, what are your end points? In other words, do you watch the skin as it gets frozen? How do you control the depth and the strength of the treatment as you're doing it?
According to your question about what is the end point how can I control the depth, I depend on the time, nothing else. I didn't look for the skin, I look for the time I applied my cryo. Because as you know, keratinocytes need 30 to 35 seconds. Melanocytes need 50 to 20 seconds, 15 to 20 seconds. Nevocytes need 10 to 15 seconds. So I attack nevocytes, I apply my cryo for certain time, 10 to 20 to 15 seconds, so that I can control my depth.
Do you hear me, Dr. Anderson?
I can barely hear you. I think my internet is not stable.
I think it may be, Professor Elmelegy, on your side it might not be stable, because I think we're all hearing it a bit choppy.
Yeah, I'm having difficulty as well.
You know my question, Yakir, is does he freeze the skin? And he probably does. And then how do you know?
Yeah.
Yes.
That was one of mine as well.
When I start my work,
yes, my aim is not freezing the skin. My aim is destructions of the nevocytes. And so I depend on the time. I take 10 to 15 seconds for the nevocytes. Before my experience, I was applying for 20 seconds, 25. I destroy all the melanocytes, and that's why I get hypopigmentation. But here I depend on the time only, not on the color of the skin or the changes. I apply my cryo probe 14 to 15 seconds to get the results.
I think we weren't able to make that out, unfortunately. The audio quality is not very good. If you're able to perhaps sign out and try to sign in immediately, maybe take a minute or two if that might improve the connection.
okay.
He might also try turning off his video. That gives him better bandwidth.
Yeah, that's okay. That's a good suggestion. Maybe just stop the video. I think the video is off already, actually.
Okay.
Is there another member of the team that might be able to answer the question? And I see a Zoom user waving if you would like to interject.
Do you hear me, Elena? You hear me?
Yes?
Barely, yes.
You won't. I will try to go out and go back, okay?
Okay.
I hear you very well. Hello, Dr. Nader Elmelegy. How are you?
Yes, I am.
I am Professor Okasha, Vice President of Tanta University for Postgraduate Studies and Research. It's my pleasure actually to be here with you and share you this very prestigious moment. I'm very proud of you, Professor Elmelegy, for this magnificent lecture that you have given in front of a very great university staff member of plastic surgery, Harvard Thank you for allowing me just to be with you in this very precious moment. Really, I'm one of Tanta University fan of Professor Nader Elmelegy. I know he's very talented one since his very far beginning of resident of plastic surgery, and now he's one of the very eminent professor of plastic surgery all over the world.
Thank you very much, my dear friend, Professor Akasha, Vice President of Tanta University. Thank you very much. I am very happy to be with us as a Vice President of Tanta University to give us part of your time. Thank you very much. Thank you very much, Professor Akasha.
Yes. Okay. Let's try this. So I think Dr. Anderson, so we'll start with his question was about what you look for in the skin. What endpoint do you see that determines the duration of your freeze?
Again, I didn't depend on anything on the skin, whether frost or nothing. I depend on the time because, you know, we have a variable type of cell in the epidermis. We have keratinocytes, we have the fibrous tissue, we have the melanocytes, we have the nevocytes. The nevocytes is the most sensitive, so I apply the cryo shorter times, maybe 10 to 12 seconds. But if I apply the time more, it will destroy melanocytes. If I apply time more, it will destroy the keratinocytes. If I apply more, it will destroy the fibrous tissue. So I am not looking for the skin, I am looking for the time that can destroy the nevocytes, which is usually 10 to 12 seconds. More, before that I was suffering from hypopigmentation because I was applying for longer times. So I didn't look for any changes of the skin. And even ulceration and debully appear later on, not on the table. On the table you can see the frost, but the time is the crucial thing for me that can control everything I am going to do.
I see. And do you have any temperature control, or do you simply do this by how it looks?
Yeah, I have no temperature control. I simply use my machine, and that's why I didn't have what to do.
And I'm sorry if I didn't understand, but the cooling is from the surface down, or is there anything invasive?
Nothing invasive at all. Just from the surface of the probe.
I see. Yeah. Thank you so much for answering my question. Have you done biopsies after treatment to look at residual disease deep in the skin?
Yes, I found. What I would like to mention here, I think this is a disease of nervous cell and is not the disease of congenital melanocytic nevi, because I found that a long time because of the melanocytes, this ends with hypopigmentation. When I take the time and fix it to the nervous cell is more sensitive to cold and needs less time. That's why I think the nervous cell, it is congenital nevocytic nevi more than melanocytic nevi.
I didn't get all that, but and how long does it take for you to do a treatment?
In one session, I do everything during the lecture, but in the session I take about 10 to 20 seconds to 15 seconds. 2 weeks interval between each session. I finish my job when I found complete disappearance of the lesion, and also I did biopsy. I found complete clearance of the lesion from the site of injury.
You know, it's fascinating to me. You may have heard about the cryolipolysis, the work that we did to remove fat. Yes, removing fat by cooling. And it's interesting. I was looking at your patients to see whether there was any evidence of fat atrophy, but I did not see any. It seems like the contour of the skin remains very good.
Yes, yes.
Are you not affecting the subcutaneous fat? Do you think?
I think it is a matter of time. In order for children to be affected with fat, they put the cold thing inside the mouth for a long time, and the fat needs a long time to do cryolipolysis to do programmed cell death. But for 10 to 12 seconds, it is not enough at all to destroy any type of fat cells. There is no change in my face of my patients.
Yes, I see. Thank you very much. I'm going to let other people ask questions. Thank you.
Rook Anderson, I would like to send a message to the Egyptians because all are using your theory, selective photothermolysis, and all people here like you and want to see you in Egypt.
Well, I would like to come to Egypt. I've never been there, and I'm fascinated not only with modern Egypt, but with the birth of civilization there 3,000 years ago. So I hope to visit your country someday.
You are welcome at any time.
Thank you.
Follow up with a question after Rox finishes his travel plans, but I was curious about the patient experience. When this is over, like, do they need sedation or anesthesia to tolerate it, or are they able to simply leave after the visit? What is the patient experience?
The host remove my photo. I don't know why. My camera. The host stopped my camera. I don't know why.
We stopped the camera because we can hear you better if your computer's not trying to transmit it. Sorry for that.
Okay. I put the EMLA cream for the children, but usually they cry whatever you put EMLA cream, and you didn't put EMLA cream. But I have a good assisting nurse. She holds the child very well. It is a matter of seconds, and he can go out. He is still crying. I think it is difficult to do idiot in the States, but here we can do something else.
Really wonderful. We've been debating the role of anesthesia because many of our patients require medicine to tolerate these treatments, so that the fact that you can do that with local anesthesia is really a wonderful thing.
I never give anesthesia at all, only local.
Dr. Elmelegy, we have a couple of questions in the chat box from Dr. Ubarab. I'm sorry if I mispronounced your name. He asks, are there any contraindications for your technique?
I'm body else inflammation, and if there is any infection elsewhere, it will cause the spreading of the infection. So stop infection, no problem. Also, I did it in diabetic patients, and no problem occurs, but you have to control diabetes. And the only thing I find is that there is infection or not.
And then another question he had is, what are the side effects or complications of the technique that you have noticed?
The most common complication when I start my work is hypopigmentation for all cases and start my work. This is because I was using a long time. So please control the time. You will finish the process of hypopigmentation. At the beginning of my work, I did a lot of cases that had hypopigmentation. But when I control the time, hypopigmentation finishes and no hypopigmentation occurs in the last case.
I'm sorry, what was that complication? I didn't catch it.
Hypopigmentation.
As a most common complication, post-cryocarboxy surgery hypopigmentation. This usually occurs in most of the cases, but finally, when I choose a time to be less and less, I found that hypopigmentation disappears and the normal appearance of the patient takes its way.
I have a question regarding for patients who have developed any scarring after the procedure. Have you required any fractional laser resurfacing?
No, I didn't use. Maybe if there is hypertrophic scar, I have published a paper in BRS. I got acceptance. I can use what's called electrophotobiomodulation, which is a combination of frequency cases after cryocarboxy surgery. Only complication is hypopigmentation.
Well, does anybody have any other questions? Oh, I'm sorry. Does anyone have any other question?
I wonder if he could send us a video of doing a case.
Okay, that's great. I have my video, but I think you told me you have 20 minutes, so that's why I removed all videos. But I will send you, and I will take your email, and I will send you to your email, via your email. Okay.
I have another question for you.
Yes.
Do you ever get on an airplane and go to the United States?
No, I haven't. I have every place except the United States, but I will be very happy to meet you in Harvard. It is our dream to be in Harvard and to see the people working in Harvard. Harvard University, of everyone in the world. I will be very happy for that.
Well, we're just people doing what you do, try to solve problems. But I'm more interested in getting to know you, and there may be a chance for us to get together either at a professional meeting in Europe or the States. I would love to spend more time with you.
I will be very happy if you send me the invitation. I'll be very happy for that to understand.
Okay, thank you.
Thank you very much.
Well, if there are no additional questions, I think we'll end it there. Dr. Elmelegy, thank you so much for your time and presenting these really interesting cases. I think we're all very impressed with... oh, we have a question. I'm sorry. Let's see. Dr. Elmelegy, you have a question?
Yes, please. First, thank you, Professor Nader, for this excellent presentation. It's really marvelous results. And I have witnessed some of your cases, very impressive. I would like to ask you about does your cryotherapy affects differently the normal melanocytes within the skin? I mean, is there a difference of cryotherapy effect on congenital melanocytic nevi? Any different from the affection of the normal melanocytes in the epidermis? How do you spare these melanocytes, the normal melanocytes, I mean? Thank you.
Dr. Al-Mufti is one of my professors. I am very happy to meet you here. In order to differentiate between, I told you that we should change the name of this into congenital melanocytic nevi and not congenital melanocytic nevi. Because when I apply my cryo near to the skin nearby, it affects the normal melanocytes and it ends with hypopigmentation. But the melanocytes are less sensitive to cold than nevocytes. That is why when I shortened the time, I spared the normal melanocytes and I destroyed the nevocytes. There is a great difference between the sensitivity of the nevocytes and the melanocytes. Thank you for your question.
So the key point is the duration of the freezing, yes, which is more affected, if you prolong the duration, it's more affected by the diseased melanocytes rather than the normal melanocytes. Yes, this is the key point.
Yes.
Appreciate it very much, Professor Elmelegy, and thank you again.
Thank you very much. I am ready to any question.
Does Basma's iPhone, do you have a question or no? No. All right. Well, again, thank you, Dr. Elmelegy, and everyone else for joining us today. And we hope to stay in touch and learn even more about your technique and outcomes. And as Dr. Anderson, as Rock said, we would love to see some of your videos that you weren't able to share today. So thank you.
I have your email and I will send you. I'm very happy to meet you, to meet Anderson, to meet Ivina, and everything you did. It's very good.
Well, thank you very much. Thank you.
Thank you. Welcome.
We will end today's meeting and we will stay in touch. Thanks so much for your time. All right. Take care. Bye bye.